Hello, peoples. It's his little Cherie. I'm on a journey to a better brain, and you're welcome to come with me. I'm reading this book, The End of Alzheimer's Program, and chapter 3 is called Man Bites Dogma, Lessons Learned. So in the last 8 years that they've been doing this program or this protocol, they've learned a lot. And this chapter outlines some of the lessons that they've learned. And I'm just going to shoot them at you like water out of a fire hose. And then in the next chapter, we'll get into more specifics. So this is just a lot of information. Are you ready? I'm going to try and do this. Forgive me, I've made notes, I'm reading them. Number 1, most people who develop cognitive decline have more than one subtype of Alzheimer's. Subtype. And usually one is dominant, which is important for focusing on one dominant subtype. Number 2, protocol may be difficult at first for those who are underweight. So doing this protocol, if you're too skinny, it's going to be more difficult for you. Beware the diagnosis of pseudodementia, and it talks a bit about that. If you don't know what that is, read the book. Number 4, beware those who tell you to come back next year. You are not that bad yet. And that's the opposite of what you should be doing, because the earlier you start a prevention program, the better. Number 5, nearly everyone with any degree of cognitive decline has at least one of these common contributors, and I think we talked about this in the last chapter. Insulin resistance, exposure to toxins or mercury, reduced oxygen while sleeping, leaky gut, poor dentition, chronic viral infections such as herpes or tick-borne pathogens, nutritional deficiencies, or vascular disease. So it's critical to test for these and treat any that are identified. However, you don't necessarily need to patch all identified contributors in order to achieve success, right? It's a bit overwhelming, so one thing at a time. The earlier the treatment, the better, and they have seen improvements in the later stages of dementia. But generally, improvement takes 3 to 6 months. But again, they've seen improvement in as little as 4 days with this protocol that they call RECODE. Although ApoE4, remember that's that genetic marker that increases your risk for Alzheimer's. Although ApoE4 positive groups, which account for 2/3 of Alzheimer's patients, have been the most difficult to treat in most drug trials. These patients respond better to RECODE than those who are ApoE4 negative, and they're not sure why that is, but it may have to do with inflammation. Read the book. Number 10, there is a threshold for improvement, so you need to continue address these contributors until decline stops and improvement begins, and that's what they call the threshold. Number 11, improvement typically occurs in 3 phases. First of all, the decline slows and then stops. Then there are small improvements, and then there are more significant improvements. And there can be setbacks, of course. The most common things that cause setbacks are stress, infections, loss of sleep. And number 11, for lab tests, beware the term WNL, which stands for within normal limits, because the normal range is statistical, not physiological, and it's not necessarily optimal for brain function. 12, continue to optimize all parameters. Don't assume that the initial treatment is optimal, because cognitive decline takes a long time, and it is a marathon, not a sprint. So don't give up. If there is continued decline, then in most cases something has been missed or the compliance has been poor. So there were a few other points, but I felt that those were the main ones. And that is actually the last chapter. Chapter 3 is the last chapter in part 1 of this book. So I'm just going to read the last paragraph of this chapter. It says, you may have seen the television commercial claiming that the first survivor of Alzheimer's disease is out there somewhere, and if you'll just donate to our organization, we'll make it happen. Well, that is quite misleading because it's not someday. The first survivors are already here. They are well documented and their cases are published in medical journals. They're referring to their own program, the RECODE program. Now, in the chapters that follow, you'll hear in detail how so many people are achieving success. And so part 2 is called the handbook section, reversing cognitive decline. So, chapter 3 ends on a very hopeful note. Now we'll get into the specifics of, okay, that's a lot of information. What can I do first? Like, give me a bite-sized thing. So chapter 4 will begin that process. Thank you so much for journeying with me. I know this is a lot, but we're getting there, one bite at a time. Love you guys.